Niacin's benefits in cardiovascular health extend far beyond its traditional classification as a lipid-modifying nutrient. New findings reveal that niacin plays a critical role in preserving macrophage viability in lipid-stressed environments, a function that may be just as important as its influence on cholesterol metabolism. Within the inflamed arterial wall, macrophages engulf oxidized LDL and transform into foam cells, setting the stage for chronic inflammation, lysosomal dysfunction, and eventual apoptosis. These dying cells contribute directly to the formation of necrotic cores, weakening plaques and increasing the likelihood of rupture. Niacin intervenes in this cycle by both preventing excessive lipid accumulation and actively reducing macrophage death, offering a dual mechanism for plaque stabilization. The foundation of this protective effect lies in niacin's ability to restore cholesterol homeostasis at the cellular level. Upon entering the cell, niacin activates CD38, which catalyzes the formation of NADP, a potent second messenger that stimulates calcium release from lysosomes via TRPML1 channels. This calcium signal leads to the activation of liver X receptor alpha, LXRA, which transcriptionally upregulates NPC1, ABCA1, and ABCG1, proteins responsible for transporting cholesterol out of the lysosome and, ultimately, out of the cell. This coordinated response prevents the buildup of toxic free cholesterol within lysosomes, a key trigger of lysosomal membrane rupture and cellular apoptosis. By enhancing cholesterol efflux, niacin reduces not only lipid burden but also the downstream stress signals that lead to cell death. Cholesterol crystal formation, cathepsin release, and NLRP3 inflammasome activation, all of which contribute to macrophage dysfunction and demise, are markedly diminished when intracellular cholesterol is properly cleared. In niacin-treated macrophages exposed to oxidized LDL, experimental data consistently show improved viability, reduced apoptotic markers, and decreased release of pro-inflammatory cytokines like IL-1S. This suggests that niacin preserves not only structural integrity, but also immune competence in these cells. The survival of macrophages within a plaque is not merely a passive benefit, it has critical implications for plaque stability. Apoptotic foam cells, when not properly cleared, contribute to the growth of the necrotic core and exacerbate inflammation. By preventing this cell death in the first place, niacin helps maintain a population of functional macrophages capable of clearing debris, resolving inflammation, and supporting tissue repair. This shifts the plaque environment from one of progressive destabilization to one of potential stabilization and even regression. Furthermore, niacin's effects on viability appear to be selective and stress-responsive. In healthy cells with balanced lipid levels, niacin does not push macrophages toward uncontrolled proliferation or interfere with normal apoptotic signaling. Instead, it functions as a resilience enhancer, activating only when cells are exposed to lipid overload and lysosomal stress. This context-dependent precision ensures that niacin's protective effects are engaged exactly where they are needed most, in macrophages under threat from atherosclerotic conditions. Taken together, niacin's ability to enhance macrophage viability through improved cholesterol trafficking and reduced apoptosis positions it as a key player in atheroprotection. It not only prevents the accumulation of damaging lipids, but also shields immune cells from the self-destructive consequences of their environment. In doing so, niacin contributes to the stabilization of atherosclerotic plaques, reducing the risk of rupture, thrombosis, and downstream cardiovascular events. This cellular-level protection, coupled with its anti-inflammatory and lipid-clearing properties, reaffirms niacin's role as a multifaceted therapeutic agent in the early and sustained management of cardiovascular disease.